The desire to stop in the first place, I think, is the first step.
If you don't have a strong foundation and a right intention, what you're doing after that isn't going to be as effective.
If I handed you $1 million and asked you to speak Chinese right now, can you do it? Just because you want to?
And there's this thing I always say, your past perceived voids create your future perceived values.
It was never to harm us, right?
Sure.
To put us in harm's way or make us have problems that need to go to therapy. If I asked for something or help, it was either probably brushed off or wasn't taken seriously, or somebody was busy at the moment. So after so many times, right, you get used to, I'm just not going to say anything.
Why you decided to be a mental health advocate and be a licensed professional. Welcome back to the Ryan Zofay experience. Today's episode is deeply personal for me, and I believe it will be for you as well. This episode of the Ryan Zofay experience is proudly sponsored by We Level Up, championing transformation, resilience, and the freedom to rediscover your best self. And my guest today, I'm really excited. She's been with the company for, like 8 years now?
Yeah.
8 years. Let's give a warm welcome to Lauren Berry.
Thank you for having me. I'm super excited.
Of course.
Yeah, excited to chat with you.
You know, it's funny. I always envisioned like having a podcast and having a show and the ability to truly show people like who we are. Like that was the goal for me. It's like I feel like we do such incredible work and we have so many incredible people, but they don't really get to experience us because they're not in the company. And so the idea was to have a podcast, have a show, and allow people to really see our hearts and why we have been so successful. Right. And you've been a huge pillar in that. I literally remember back when we were in Boca. Remember we were launching the Boca facilities?
Oh, yes, I do.
And so why don't you tell us a little bit about yourself, Lauren, and why you decided to be a mental health advocate and be a licensed professional?
Sure. So thank you again for having me.
Of course.
I am a licensed marriage and family therapist in, 5 states now. I'm an EMDR therapist, trauma trained. We'll get into that.
Does that mean you have a successful marriage?
If you ask my husband, it depends on his answer. I say all the time, like, you have to have your own podcast almost about being married to a marriage therapist because that is something in and of itself.
Yeah, and you have 3 kids.
And we have 3 kids. Yeah.
Wow.
Yeah.
I've watched that entire journey, and it's so cool.
Yeah.
You know, it's funny because and the reason why I asked that is because I think, I don't know if this is an accurate statement, but I think like 1 out of like 5 therapists are actually successful. You know,
Makes sense, honestly.
I don't know if it's real or not, but like in my mind, like I've met so many therapists in my day, and the ones that actually do the work and practice the work are successful. Most therapists don't do the work.
It's funny you say that because I was thinking about that like throughout my career and like coming on here to talk. The biggest thing that has helped me be successful and actually help other people is my own therapy. If I didn't, like the therapist I was prior to doing my work, like I don't know who that person is. And I was not good, but green, right? Like just not impactful, at least on the level I feel like I am now.
Yeah.
And I would 100% agree. Like you can only take somebody as far as you've gone.
That's so good.
And to your point of like having this podcast and showing what we do and all the successful and just great people you have in your company.
Sure.
I feel like a big part of that is because we've done our work. You
So
know,
good.
we can impact people because we helped ourselves.
And it's so interesting. And you were here for the experience when I decided to come back and I was going to do these new trainings every week. We're doing the trainings. And I remember I went to Tony Robbins and I recognized that like I was the problem. I was the chokehold. So, you know, the leader is the chokehold. The business owner that's having a hard time in business scaling or creating a culture, it's because of you, you know, it's because of you, the owner. And I remembered coming back and just not having any idea how to facilitate a training program or facilitate a coaching, a seminar. Bring us back to your first coaching experience. What were you thinking when I came in? Like, this is what we got to do.
New one?
No, old, the first time. Well,
it's funny you say that too, because comparing old to new you can tell where the work came in for you. And I don't know if I'm like overstepping
No,
or
please
speaking out of turn.
speak out as openly as you want.
You seemed more like comfortable and like knowing what your not purpose necessarily, but like intention was.
Sure.
Like it was clearer, I would
Sure.
say. And I think you had more people bought in like the
Sure.
second time around. The first time we were sitting in that loft, I want to call it, in Boca Detox
Yeah.
at the time, and it was like a handful of us. And I think too, then though, we knew what you wanted to do. Like we knew your heart, we knew your intention, we knew the purpose was to make everything better and everybody better and help clients and all of that. But it's funny to compare the two. Like this is now on a different level. I mean,
Wow.
it just is. You could tell. And
Yeah.
I think I'm sure there was just more work that went in between those times.
Yeah, and you said something I think is important. See, the intention happens before the action.
Right.
And so yes, you have to be aligned with your heart. You have to have the right intention. And once that is in place, that's like your foundation.
Right.
And what you're talking about is like the work that you do when nobody's watching is actually what's establishing the foundation.
Yeah.
And then you do the action. You're
Right.
performing, you're coaching, you're teaching, you're speaking, you're
Right.
being a business owner, you're operating, whatever. And so if you don't have a strong foundation and a right intention, what you're doing after that isn't going to be as effective. And that's, I think, what you just mentioned
Yeah.
in terms of like the clear distinctions between like a super talented therapist and somebody that's just kind of going in to get a paycheck. It's funny because when I started the idea of like, I need to coach my people, I started to think about that concept. Like if I impact, I don't know anything about your licensing and your modalities and what you've mastered and specialized, but my thoughts were like, well, if I can empower Lauren to be a better human being, to feel more inspired, to feel more connected to herself, to feel more of a whole person, then her mastery is only going to be transferred at a higher level.
Right.
That was the thought when I started it.
Yeah. And I think it translates. Like it's because again, going back to like me being a marriage therapist, my husband is in recovery, as you know.
Sure.
And before we got married, before we got engaged, anything, he was still up and down at times, right? I've seen the low lows, I've seen the addiction, I've seen the recovery, thank God now. And in that, I would tell clients this even after. I was a substance use professional doing it for a living, and I couldn't see it in my own home.
Wow.
Like, that's wild to me. Like, that goes to show how strong denial really is.
Wow.
You don't want to see things coming. Honestly, how good addicts can hide things
Sure,
as well.
sure.
And I say that as, like, weirdly a badge of honor. Not honor, but, like, transparency.
Sure.
Like, it's possible to be good at something and know it from a textbook standpoint, going to, like, intention and purpose, right? And still not fully understand it, be
That's so
enveloped
good.
in it and all that. And then when I did my own work to separate like codependency from him
Sure.
and like being wrapped up in, is he okay? Is he using? Is he not? Once I detached and did my own work
So
on being
good.
my own person, our relationship changed.
Wow.
His recovery is separate, but like I'm sure impacted in a way him getting help and getting healthier, the healthier I got. And then again, working with our clients, working with our staff, like I'm just a different person.
It's so crazy. Like who you were when I met you and who you are today, it's night and day. And here's the interesting part. After she got her home life figured out and stabilized, the babies came. When there's safety in the home, babies come.
Not by chance, but like, yes. And I think it goes deeper too in a way of like, we were not supposed to have kids, right?
Wow.
Prior to
I
that, because
remember.
it wouldn't be safe for them.
I
It wouldn't
remember.
be like, it all happens for a reason. And
Yeah.
exactly. Look at the intimacy that gets built when
Sure.
there's safety, when there's, independence, healthy boundaries. Like it's the healthiest we could be.
Yeah, and I've met so many therapists in my day, as I mentioned, and you have definitely been someone that has stood out and has been a rock star. So I'm honored and grateful to have the time I've spent with you. Why don't you bring it back to like your earlier years and what really happened for you that drove you to want to be a licensed family and marriage counselor?
I don't know I could tell you I've always wanted to be a therapist. Like I know from as far back as I could remember.
What age comes to mind when you think of?
Probably before middle school, maybe elementary school. I remember in second grade, this is the only other thing that stands out. I wanted to be a news anchor.
Okay. Because you want to be on TV? Or?
Yeah, like I wanted to do this almost like be on a stage, talk to people. Like I love it. And then that stopped after second grade for whatever reason. But after that, all I can remember is wanting to be a therapist, like psychology. I just loved the idea of knowing how people's brains work.
Wow.
I wanted to really I wanted to be a forensic psychologist and interview like serial killers because
Really?
I thought it was fascinating. Like
Sure.
just how you become that and how your brain works. Honestly, I don't think it's a far reach to now go to addiction and mental health because
Sure.
it's the brain, right? And just
Yeah.
how it functions, what lights it up, what doesn't, how people fall into these different things. So that's what really intrigued me. I just always had that interest. I don't totally know where that came from necessarily.
Well, I was gonna say, like, what was going on in your home life during that time in middle school?
So
Or you said second grade?
yeah,
grade.
probably elementary school,
Second,
but
okay.
I became more aware of it, you know, in
see.
middle and high school, I would
So
say.
yeah, so second grade, what was going on for you in your home life?
Well, I come from an Italian family, a very Italian family.
Okay.
Very loving.
Can
very
mom cook really good Italian food?
Oh, you have no idea. My husband says, I like my mom's cooking, I like your cooking, but your mom can make some stuff. So yes, very, very Italian, but with that comes a lot of privacy, a lot of, and this is just my
Like, don't express your emotions.
Correct.
Don't tell anybody that we got problems.
Exactly.
Keep our family business here.
To this day.
Yeah.
Like everything is confidential. And you know, I'm a product of that, so a part of me still understands that
Sure,
mentality,
sure.
but I'm not like that. I never really was. I would say I'm the black sheep of my family. I don't know if they would see it that way, but I always have.
Sure.
Because of that. Like
Sure.
I'm out there, I'm social, like I'm an open book. I can't really hide things, probably when I should. So my family was very, again, loving and outwardly like a perfect little Italian family. But I always kind of felt misunderstood. And because of that, I didn't see things the way they saw things. I didn't
Sure.
agree with certain things. I was the rebel who spoke out about it. I still do. It can cause some conflict sometimes. So I think maybe feeling that way in my family, I wanted a place to help people open up, be transparent, talk.
Isn't that wild? Your experience in your family home was like, hey, from the outside looking in, it's great. But you just felt this massive void internally because you couldn't like express yourself or be open.
Right.
And so immediately you're triggered, like, I want to give people a platform so that they can express themselves.
Exactly.
And that's what drove you to be the black sheep, so to speak, to be that outwardly, openly, vulnerable, outspoken part of the person of the family. And there's this thing I always say, your past perceived voids create your future perceived values. And so speak to the voids that were developed in those earlier years for you.
The voids were really like emotional connection, honestly. Like me
Not having an emotional connection.
and like not knowing how to even connect my own emotions because like going hand in hand with the privacy kind of aspect, like you didn't talk about feelings, you know.
Right.
I have family that's still to this day, they're like, oh, therapy, like that's brainwashing people.
Right.
Like that's how it's viewed.
Sure.
So again, not really knowing what my own emotions are. Working with my therapist, like I can't cry in front of people. I just cannot. I will cry.
Still to this day?
Mm-hmm.
I think I might have seen you cry a couple times.
You probably broke it out of me a couple of times.
I think I've seen it a couple times.
Probably. But it's very hard. Like
Yeah.
it's not comfortable for me. And I know for
So
like
what
a
you're
lot
saying,
of
it's like
people-
it's like a muscle. It's like strengthening a
Yeah,
muscle.
Exactly.
So I think that's the misconception. Most people think like, oh, that's not me. I'm not doing that. No, it's just like going to the gym. It's just
Right.
like starting a business. Like you have to get the practice. And so, yeah, it doesn't feel good in the beginning. It's uncomfortable in the
Right.
beginning. But then once you start to allow yourself to kind of move through that, it becomes a new conditioning.
Right. And I had nobody to guide me through
Sure.
that. Like I had and now I see it with me as a parent to my kids, like cry, right? Sad is okay.
Yeah.
Anxiety is okay. Depression is okay. It's what
Sure.
you do with it. That's a different story.
Well, yeah, emotional integrity is the ability, in my definition, the ability to express all emotions when they're available.
Right.
Because then you're truly being a whole
Authentic.
person, an authentic person.
Right.
Like you're not fragmenting yourself. You're just like fully expressing.
Exactly.
I think that's
Exactly.
so powerful.
Right.
But what's crazy is like, so not having that growing up drove you to want to have that.
Exactly.
So what a
Kinda
gift.
Like, right, exactly. And that's why you've honestly said this a lot that I have kept with me and helps me. Like, parents did the best they could, right? Whether it's right, wrong, or indifferent, the intention was never a negative thing. It was never to harm us, right?
Sure.
To put us in harm's way or make us have problems that need to go to therapy.
Sure.
It turned out that way, and that's okay because I wouldn't be where I'm at. I wouldn't be helping the people I'm helping. I wouldn't have fixed my own stuff. Wouldn't have met my husband, had my kid, like all these things.
Sure.
if that didn't happen. So I agree, it's a gift. You know, it was challenging at times, and there are certain things that I can't even say I wish would go differently, because then I wouldn't be where I'm at.
Well, that's how you know you've done the work. And this is a good indicator if somebody truly has healed, is when they can honestly say, looking back in my life, I wouldn't change anything.
Right.
That's when you know. That's a good indicator to see, like, hey, has this person done the work or not? Because if you pick up on people's language and they're like upset at a part of them, or they hate a part of them, or they don't agree with certain things that happen to them in their life, then clearly there's more healing to be done. And so congratulations, because you just pretty much, you just passed. You passed. She's done the work.
Thank you, therapist, for all those years.
She's done the work. But I think that's so important, because when you're looking for the right coach or the right healer or the right treatment center, if the people that you're going to get help from aren't doing the work, you're not going to get the help you're looking for.
I 100% agree. Right. I'm going to just go out on a limb and say, like, pointless in a way, right? Like, it's, and not, okay, I take that back. Because everybody's journey is their journey, and the parts of the journey are there for a reason. And I agree, again, like, going back to clients even I've treated before doing my therapy, like, my therapist would say that to me all the time. You can only take people as far as you've gone. And that's clear as day to me.
It's so true.
Like, again, even my husband,
So
like,
true.
I was harming him probably, if anything, than helping him. When I was clueless about certain things.
Let me just, for those of you that I coached before I did my own healing, I'm sorry. So I want to say sorry.
All my past clients.
Sorry.
You want to come back now?
Yeah, come back. Let me get a mulligan.
Yeah, I don't know. But it's so clear. Like, I think it's really, and it's cool to see, in my opinion, because you see the growth in yourself, and it's something to be proud of. And like, there are certain people I could help today that I would have no clue where to start before. It just.
And I think what's interesting, what you're saying is, like, I can't take you somewhere where I haven't been before. And really what that means is, like, once you've, like, spotted it and healed it, you can spot it in somebody else. And you just said, like, I was in this dynamic with my now to be husband. I didn't see the patterns I was swimming in. I didn't see the color of the water I was swimming in, because you didn't do the work.
Exactly.
And then you did the work. You're like, oh crap! Now you can see it in somebody else.
Yeah.
I was watching. I was listening to a Dr. Joe Dispenza video, and he said, if you want to see where you're at in life, take a moment and pause and look at what's happening on your outer world. And that's a direct reflection of how you feel on your inner world. And I was just like, whoa, that hit.
It's so true. I remember sitting in my therapist's office, and I did EMDR with her. But before I did, I remember asking her, like, because my MO, as you probably know, I need to know. I need to know how to do it.
Yeah.
I can't go with the flow all the time. I need, like,
now.
Exactly, how's this going to happen now? And I would literally say that to her, like, okay, but what do I have to do to heal? How do I heal? What do I do? When am I going to heal? And she's like, this is part of the work.
Right.
And I remember her telling me, though, you can't see it until you see it.
Wow.
Like, you're in the phase where you cannot see it, so it's not just going to appear because you want it to.
Sure.
And she would use the analogy with me, like, if I handed you $1 million and asked you to speak Chinese right now, can you do it just because you want to?
Right.
And I was like, oh, damn, no, I can't.
Wow.
Like, you have to practice, you have to learn the alphabet, whatever.
Sure.
And it just stuck with me of what you were saying. Like, when you're in it, in those waters, you just can't see it until you can. Till you do the work and it appears and you make progress.
Sure. And so, growing up, you're like, hey, this is what I want to do. And then talk about, like, your middle school years, high school years. Like, what was life like for you?
Not great.
No.
Middle school was hard.
What was hard about it?
Honestly, girls.
You didn't get along with the girls.
Being a girl in middle school is hard. Just
I
being
got you.
very grateful you never have to experience that. It's not fun. I think about it with my daughters, like, those years are going to be not fun to navigate through. But people are mean, right? It's just an age where
Bullies,
developmentally, right? Like, you're in that phase of the world revolves around you. It's egocentric. Your friends are the most important. You stop listening to your parents. You get in some deep waters. It's really weird to navigate. So I went through maybe in hindsight a little bit of bullying, but just bad friends, good friends, not nice friends, a whole bunch of things.
So you didn't like middle school?
No, hated it. 7th grade was awful.
Okay.
And then high school, I went from my parents' perspective, down a bad path. Nothing compared to some other people.
Did you disagree with them?
Oh, all the time.
So you felt like you didn't go down a bad path. They think that you did.
Yeah, I think I went down an okay path.
So why do they think it was bad?
So I'm very smart. Like, I like school and I always got good grades. Like, I graduated college with 1 B and the rest A's.
Sure.
But in high school, I had like F's, D's. I barely graduated. The only thing that got me motivated to start doing better again is because I wanted to move away and go to college. I didn't want to stay home because we were butting heads. I have an older brother that's 6.5 years older than me. So he was out of the house when I was going through these years. He was in college doing his thing, and I was home alone. So I was kind of like an only child in a way. And because of that, like, emotional disconnection, I felt very much by myself. Like, I just, I figured things out on my own. I didn't talk to my parents that much about certain things. I was afraid to, in part. My dad is like the Italian dad that, like, you could be scared of. So things just weren't talked about necessarily. And a lot of my friends in high school were using drugs, like hard drugs in high school.
Right.
And I never did, but I didn't do as crazy of things as they did, but I had them around me.
Sure.
And my parents would always, still to this day, they're like, I don't get why. Like, why did you want to be with those people? And it was very stigmatized and, like, looked down on. And I got roped into it because that was my inner circle.
And why do you think you chose to be around them? So I have to assume you knew that they probably weren't the best people to be around. But do you feel like you found the ability to have more expression with that community?
Probably. And I think I'm a rebel by heart. So I think the fact that
Prove 'em
it
right.
wasn't right.
Prove them wrong with
Right,
it. Yeah.
exactly. Like, you're going to
I'll
tell
show
me.
you.
I do to this day.
Yeah.
Like, my mom told me I should do something, and I purposely just did the opposite because I'm like, no, I don't want to be told what to do.
It's so funny.
So that was a big personality trait that I realized.
Sure.
But yeah, it was like a connection. We got along, we hung out, we talked. Like, everybody had similar interests and things to chat about, and it was the cool crowd and kind of all that stuff. And you get lost in it. And I think it's funny because I ran into one of these people like a month ago. Because I grew up in Boca.
Sure.
Boca's a small town in a way, and I ran into somebody from high school, and I remember I never thought I'd see this person again, like, ever. Went down a really dark path. I was like, that's the end of that. And seeing this person, my instinct now was like, I have no interest to reconnect.
Oh, wow.
Like, because of how much I've changed and grown, like, it just doesn't fit anymore.
Yeah.
But back then, I think it was a mixture of feeling alone, feeling lost, feeling like I wanted to fit in and be with the cool kids, and that's what I did.
And how much of the family dynamic do you think contributes to addiction and why people choose to use drugs or medicate or escape?
Right. I think a lot. I think something we said before, like the black sheep concept.
Sure.
And I tell clients this all the time too. Like, being the black sheep is a good thing. It's showing that you are outside of the dysfunction.
That's so good.
Like, the normal is the dysfunction,
Sure.
right? The black sheep is a person that sees it, doesn't want to go with it, right? And then sometimes the only coping skill you know to do is a drug and alcohol, a self-harming, depression, whatever it is, because that's just what you learned growing up. And the family dynamic sometimes doesn't help because you're not teaching the healthy things, or you're viewing it as the black sheep, like you're the one that's wrong. We're not.
And would you say like the core of it is the inability to express emotions?
Yeah.
Creating an environment where like the child that's getting older doesn't know how to express, so they're looking for something external.
Right. And even if it's not an emotional expression, something external to cope. Like, at the end of the day, it's not knowing how to cope in the best way for you. So, for example, we'll take my family. If my family does not know how to teach me how to talk, how to not even express an emotion, but understand it. Like, this is what anxiety could be. This is what sadness is. This is what anger is. And it's all okay. When you don't have that, you're left to figure it out by yourself, or learn from not the best sources maybe. And then it gets translated into the snowball potentially of an addiction, where that's just all you've learned and you've accumulated it, and then it goes down its own path, as we know.
You know what's funny? I used to think addiction was hereditary, and I still have a version of that, but I have a slightly different understanding today. I think patterns and behaviors are conditioning, which would be hereditary.
Right.
I don't think addiction is hereditary. I think that once you do a bad pattern long enough, it then becomes an addictive personality, because there's this this negative connotation that like that you were born into an addict.
Right.
I don't know if that's entirely true. I think that because when I think back of my childhood, like if I got the healthy support and the love, like I didn't want to use drugs. Like it wasn't like embedded in me that I'm going to be an addict.
Right.
Yeah, my dad was an alcoholic, my mom was a drug addict. So yeah, clearly I'm going to pick up those patterns. I'm going to replicate their behaviors, which ultimately drove me to using.
Right.
But then once I started to heal those core issues and addressing those core voids, like my desire to want to medicate is gone.
Right. The psychic change.
Yeah.
Yeah. I mean, I couldn't agree more. And again, using my own family, my husband as an example, my kids technically, right, will have a genetic predisposition to an addiction. And we know plenty of people that have kids that are not, but they're in the program.
Right.
And if we teach, meaning me and my husband, like if we teach them now the stuff that we didn't get taught,
so good.
then that can go out the window. That doesn't mean it has to turn into anything.
That's so good.
But the drugs and alcohol are not the problem.
So you're a believer that if you address the core issue, the likelihood of them using or wanting to use minimizes significantly.
1,000%.
Wow.
1,000%.
And what would you say would be the distinct difference in our organization and what we do different from other people in our space?
Getting to the core issues. You know, we have people, myself included, that are trained in that. And I think, honestly, I think you've built a not program, it's not the right word, but an industry, right? An empire, a company that have people around you that know that and understand that from all different disciplines, doctors, therapists, BHT, whoever. And again, intention, right? And attracting the right people, that's who you've attracted, people that know it's deeper. Right. And we have to get to the inner child. We have to get to all those things. And everybody will have a different variation of it.
Sure.
But I think understanding that exists and that we have to treat that is what can set people up for more success. And again, I think we have people that understand that as a whole, if that makes sense.
Yeah, 100%. And it's so crazy because when I think back of like wanting to grow this business and scale it and really help as many lives as possible, I recognize like I'm not the master at all the things that need to be done, but I recognize the skill that I needed to master was the ability to influence, the ability to inspire, the ability to be the example. And I think that's the misconception with leadership is like there's a lot of people out there that are like dictators. Like they stand at the top of the hill and they're like, this is what you need to do. Da, 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 da. And I realized if I want to truly impact and really make a difference, I have to get in the trenches.
Right.
And I had to be the one to roll up my sleeves. Right. So a lot of these organizations go out there and they hire these trainers, which I think is great. I think all this stuff's cool. But I was like, you know what? Screw that. I want to be the trainer. Yeah. I want to be the one because I get to become a better version of myself. And that was really the thought was like, anytime I think about doing something that's difficult or challenging, the first question I ask myself is like, who am I going to become because of this?
Yeah, and I think that's something that's been attractive, like knowing you and from your journey and working for you and for this company has been a really big gift and big blessing is like, again, you walk the walk, you talk the talk, like you've done it. So to your point, like even have a coach or a trainer, it misses that personal connection, right? Like we know you and it's so appreciated when you do it and when you show up because that's what speaks volumes. And to your point, probably like that's what motivates people.
Sure.
You know, it's you showing up. That's a big deal. And you do all your personal work. And again, you're talking the talk and walking the walk and that translates. Yeah.
Yeah. So bring me to like a success story that you have. So you've been here for 8 how long? Just
2017 was when I started.
So what is that?
8 years.
8, 9 years. Wow.
I can't do math.
So in 8 years, like what's like a highlight success story? And walk me through, you don't have to say the patient's name clearly, but like talk about where the patient was at, like what were they dealing with or symptoms, and then the work that obviously you did and the support that you gave that patient. And then, like, where are they at today? Like, what's a success story that you have?
So I do have a patient in mind, and it's a trauma EMDR patient because what do I want to say? The circumstances around it, like, you almost think are made up. So, and I have to speak in as little identifying information as possible. There was a patient that was grieving a death of a parent. And
which is very common.
Right. and grief in general, right? I
Sure.
mean, it's one of the hard, even as a therapist, honestly, it's very hard to help somebody navigate through
Sure.
because it's so personal, it's so individualized, it's different it's very challenging in my opinion. I give a lot of credit to like grief counselors because it is
Sure.
not easy. But she was dealing with death of a parent and a lot of guilt and shame that she could somehow change it, the outcome, fix it, control it, whatever, right? She was kind of living in what if
Sure.
and the denial stage and bargaining, the stages of grief. And we did EMDR. And let me actually go back. So when she, and I'm speaking slowly to make sure I keep it private. When she got the news of the passing, there was a specific.
So she was with us when the passing happened.
There was a specific event happening, right? And that was always tied to. No, I'm sorry. The call was prior.
Okay.
She was a patient dealing with this.
I got you.
But there was a musical event happening whenever she found out about the passing, and that was tied to the grief, right? This event was strictly connected to what she was grieving, and it brought up a lot of triggers and bad memories, right?
Sure.
So cut to, we did EMDR. As we were doing EMDR about the passing, she tells me that there's the same event is coming back, and it's on the anniversary of the death.
Jesus.
So it was very clear
Very
of like how
emotional.
this was going to be a trigger or not anymore, and very emotional.
Yeah.
I mean,
so can you explain what EMDR is?
of course. So EMDR stands for eye movement desensitization and reprocessing.
Okay.
So hence why we call it EMDR, because it's a very long name. It is a trauma modality, right?
Okay.
Specific for trauma, and it uses bilateral stimulation. So eye movement, kind of. If you ever watch Criminal Minds, they
Sure.
have it in an
Yeah,
episode. You follow like a light track, side to side, left to right. Or you have tappers in your hands that go left, right, left, right.
And
or
it
you can
triggers
do
a
audio.
memory, a moment or experience.
Right.
Yeah.
So the therapist will guide you through a specific memory or image that is really distressing to you still. A common obvious example is like a sexual assault, right?
Sure.
You have an image of that, you have a memory, and you want to get it to a point where it's not, I like to say the word charged, it's
Sure.
just not charged anymore.
Okay.
The memory is going to be there, but it doesn't have power over you
Sure.
anymore.
So you don't get triggered about it anymore.
Exactly.
Yeah.
So this client, like that musical event would still bring up a physical reaction, an emotional reaction, might cry on demand, whatever, right? It's a trigger. It holds
Sure.
some power. So now when you go through EMDR, what I like about it too is I describe it as like a private processing because you don't have to talk as you're doing it.
Sure.
So it's not talk therapy, right?
Sure.
You're sitting there being prompted and guided, but all you have to spit back to your therapist through it is that like it's working or not.
Yeah.
You don't have to go recount every single detail.
Sure.
So I like to say it's like a safe way, to go through trauma because a lot of people get nervous about it. So with this particular client and that trigger, once she went through EMDR and you go from how distressing it is, the goal is to get it to a 0. Once we got it to a 0,
Wow.
she's like, I'm going to go to this event. Like whenever she was able to, she's like, I'm going to go and I'm going to be okay because it's no longer a trigger. So long story short, we go from this being tied to the day she found out of a parent passing
Wow.
to being able to attend on the anniversary and having a good time and enjoying it and not
Wow.
feeling like she was responsible for anything anymore.
Wow.
And talk therapy would have only taken her so far.
Sure. That's so powerful. And I agree with you. Like I feel like, and I think talk therapy is beneficial. Every therapeutic modality, in my opinion, my hat's off to them because their intention is to help. Their
Right.
intention is to give skills and tools that impact people, that move people forward. And so I think all of it's great. I have an opinion that if you're not going to the core, if you're not addressing the core, then you're just delaying the healing. You're delaying the person from having freedom because that's the point for me. And so like, So I love it. I think the ability to go back to a moment in time when something was so traumatic and something was so overwhelming and then allow somebody to like really heal that part of them and integrate themselves and no longer have guilt or shame around the moment or the experience, that gives so much freedom.
And it's funny because she even said to me, she's been in therapy before and been in talk therapy and CBT. She could name the modalities.
Right.
And she's like, I know what you're going to, before we did EMDR, I know what you're going to tell me. I know what the homework assignments are going to be. I know what you're going to recommend. It doesn't work. So to get to this was not only like very cool for me to see her journey, but you know, for lack of a better word, like worked, right? Like
Sure.
she worked through something instead of just circling the drain around it, and it doesn't really
So
change.
true.
And then, you know, plenty of other patients, like with the drugs and alcohol, there's a way to mask or put a Band-Aid on what's happening, right? Like, how are we going to deal with this trigger? How are we going to deal with saying no if somebody offers it to you? Whatever. But if there is a trauma, a resentment, just a distressing experience that you don't address, how are you not going to end up back into whatever was helping you cope
so
in the
true.
first place? It's
It's so true. And I love what you're saying because, you know, I say, like, if you really want to heal it, you have to feel it.
Yeah.
Like, you can't just like throw a Band-Aid over it or just disregard it and like, oh, what are your relapse triggers and just
Right.
like avoid it, stay away from it. Yeah, that stuff is necessary, right? They
Right.
say like change people, places, and things in
Right.
recovery, which I think is so important. Like, if I'm an alcoholic, clearly going to a bar,
Right.
being a day or two
Right.
sober isn't going to be beneficial for me. But if I could take a step back, heal the core issues of why I want to drink in the first place, and I do heal those, then there's going to be a day in the future where if I decided to go into a bar, I'm not going to be triggered
Exactly.
by it.
Right.
Because I'm like, oh, I don't want that, because there's no longer a void. There's no longer a need to fill that void.
Right.
And-
And I think, not to cut you off, I
you're
think a
good.
misconception not misconception, but what people don't think about, saying in treatment, right? You're that pink cloud. You may feel great, right?
Sure.
After 30 days, 60 days and learning these things, and you're like, I got it, I'm good. It will come back
It
up.
does.
Like, it is unavoidable. It will come back up. So getting to it sooner rather than later, exactly what you just described, like,
Sure.
will help you in so many different
So
ways.
true. And that's really when my healing journey really began, is when I started going in and finding out like these core
Right.
issues and the causes of what the heck's going on.
Exactly.
And giving myself the time to like really feel those feelings and make sense of them, because I didn't understand, you know, like I didn't understand why my mom at 6 years old decided to force me to go to Publix and
Right.
steal food and steal, you know, drinks and whatever I had, like steal money from my dad. Like, I didn't understand that. Like, I literally remember my mom was high as a kite. I didn't know this at the time. And my dad was sleeping, and my mom convinced me to army crawl in my dad's room to steal his wallet because my mom didn't want to wake him because my mom needed money. And I remember I did it. And then my dad found out about it later and spanked me. And I was so confused because I'm like, wait, mom said I could do it. Dad spanked me. What the hell is going on?
Exactly.
And I was, that destroyed me. And that memory, like, energetically would like
Charged.
I would be like,
Yeah.
I couldn't trust nobody. Like
Exactly.
I had walls up. I'd push people away. But when I went back and I healed that, and I cried, and I allowed myself to express myself, I made sense of it. I gave myself that time and space to really address that core issue. All of a sudden, I started to let people in my life.
Right.
All of a sudden, I put the walls down.
Right. It's what you're saying is something I wanted to mention too about like why EMDR works and like how it works. So that's traumatic, right? Like that's an emotional plus physical trauma
Sure.
that goes on. And it's not just like what they call big T trauma. Like big T is the more well-known things I would
Sure,
say,
like
like
death,
sexual
abuse,
abuse,
yeah.
right? Physical assault, domestic violence, things like that. But there's also small T trauma where things get filed
Sure.
incorrectly and you didn't have a space, like I didn't either, to process what was going on. That's
Sure.
like the missing link of why trauma becomes trauma. There's no space to process. Something may happen to you, and if you have an appropriate place to talk about and process it, it may never become a long-term trauma,
Sure.
right? Because you're appropriately filtering through
Sure.
it. So I like to tell people too, like, if you are a visual person, that is like having a crumpled piece of paper, a bunch of them in a filing cabinet, and just shoving them closed,
Yeah.
right? How hard that is to do.
Sure.
Once you heal it, that paper exists. It's still there, but you're learning to like unfold it, get the creases out, unwrinkle it.
So good.
You file it, and it fits so much better.
So good.
Like it's
It's so wild because like I think about like the distinction of like big traumas, little traumas. Like if you grew up and your mom or dad worked a lot, you're experiencing a small trauma because there's a lack of attunement, there's a lack of attention, so your needs aren't being met, and then all of a sudden that is embedded into your nervous system, and then you get older and you have a hard time like speaking for yourself or having a voice, and there's like a lack of confidence.
Yeah.
And it's just because you didn't get the healthy attunement or attachment needs as a child growing up. And so many people don't understand this, and they think today there's like a business problem, or it's their partner's problem, or they can't really identify like what the hell's going on. It's because they haven't addressed those voids that were established at those earlier years.
And I can relate to that because my childhood, I'll give you an example. I was like 6 years old, and my dad had a motorcycle. And I remember I was trying to help, right? Be helpful. I wanted to, that's also a thing. I people please. I want to help everybody. Hence why I'm a therapist.
Sure.
I use it for good now. And the motorcycle was really hot still. And I leaned up to cover it from my dad, I remember, and I still have a scar.
Oh,
I
wow.
leaned up against the pipe, and it burned my leg. My reaction, everybody was home. My entire family was home. I ran into my room by myself and cried and didn't tell anybody.
Wow.
Like for whatever reason, I couldn't ask for help.
You didn't
like,
feel safe enough.
Correct. Like
Wow.
I was not taught I was taught throughout the years, this, little T trauma, like if I asked for something or help, it was either probably brushed off or wasn't taken seriously, or somebody was busy at the moment. So after so many times, right, you get used to, I'm just not going to say anything.
Right.
So that's what happened. And now it still affects me to this day, even doing my work. I'm now very aware that I have a hard time asking for help.
Sure.
But to your point, you grow up into adults, right? And into things you do and ventures you do. And those things are there. Like
That's
those
so true.
patterns, those personality traits develop, and they carry with you.
It's so true. I mean, growing up, I mean, we're conditioned, like our responses are a conditioning. And so I think it's important to understand that, because like if you're struggling with something right now in your life, whether it be alcoholism, addiction, mental health, depression, anxiety, it's normal. It's common. Right. That's a conditioning of what didn't happen for you as a child and growing up, and it just compounds and it gets worse. Right. And so the way out is to seek help and finding somebody that can bring you to a place where you can address those core issues.
Right.
And what was the thing that you did in your work that helped you have more awareness and the ability to start asking for help? Because I know that was something where you were like, I'll figure this out, I'll do it on my own. But like, what was the moment for you where you're like, aha, I now understand why I'm doing this? Making
the connection. So like doing EMDR myself in therapy, and kind of what you just said, like just identifying it, like realizing, holy shit, like that's something I do, and that's a pattern, and it stems back from all the way back here. And this is maybe why, because I felt brushed off all the time, whatever it was, right? That identification, and that was through EMDR, that really helped me see it and realize that it exists. Plus, it's not something to be ashamed of, right? Like that was also a turn for me, that like, it's not a bad thing that I'm like that, or whatever message I was telling myself. Sure. And then I have to credit my therapist. Something she did that was really helpful that I try to replicate. She would help model for me how to ask for help. So specifically for me, it was in my relationship with my now husband. I would be a little bit of codependency too. I was really afraid to have certain conversations because I didn't want conflict. I didn't want to get in a fight. If he wasn't the healthiest, then it would blow up anyway. It was just, I didn't want to touch it, which is also how my family was. Like we avoid conflict on a certain level. So again, I never learned how to do it. So her showing me and literally saying, well, why don't you try it like this? Why don't you say it like this? And then I would go home and practice it.
Sure.
And then I would have good outcomes. I remember going back to her and I was like, it went great. And she's like, well, yeah, no shit. Like I told you it would.
Right.
But I had to practice it, and having the modeling, I think, really helped.
Yeah.
But it's still something I have to consciously do.
Sure. I mean, I think it's so, you hit the nail on the head, right? Like a modeling excellence. So if you're looking to get help, if you're looking to grow, find somebody that has a practice and they're doing the thing that you want. They've actually grown the business, or they've healed the trauma, or they no longer are in the addiction or alcoholism. I mean, that's why I think 12-step program is so powerful, because it's like one alcoholic helping another, one addict helping another. And it's easy for me to sit in front of you and say, hey, I'm an alcoholic just like you. I know this is your first day, but I got a year sober. They're going to be like, what? How the hell did you do it? You know, like it makes sense. And I think so many people fall short in that category. And I think that's where we've done a really good job at I don't want to use the word, but it sounds,
Yeah.
I mean, enforce, you know, like we require our staff and our people to practice
Right.
the healing.
Right.
Like if you're not practicing healing, how the heck are you going to teach healing?
And it is such a standout, right? Like us doing the trainings and like the staff meetings we do of incorporating that into it. Like you don't have that anywhere else.
Right.
You know, I've never had a job like that. I don't know if any of us have really, but it's impactful. Like it forces connection. And right, force sounds bad, but I mean
know.
it in a
It's
good
kind
way.
of a force, yeah.
But I mean it in a good way.
But they're
'cause-
inspired. They're
Right,
inspired.
It's a attraction, right?
Yeah.
But it makes you want to.
Sure,
truly.
sure
It makes
does,
you
yeah.
want to connect with other people and like bond. And at the end of the day,
Yeah.
the stronger bonds you have, you know this obviously
Yeah.
too. We say it all the time. It trickles down. So if the leadership, if the staff have those bonds, those understanding, we used to do experiential stuff as staff,
I know.
right? Like, and it helps.
I know.
And then you trickle it down.
Yeah.
But it's a game changer,
Yeah.
and it's really bonding. I mean, that's like the best word I could say.
It's so true.
probably.
You know, it's funny. Whatever. When I first started becoming like this facilitator of change and this catalyst, and I was like, I'm going to be the next Tony Robbins and I'm going to heal the world. And that was like, I was on mission for that, and I'm still on mission for that.
Yeah.
Slightly changed though. I was like, how the hell am I going to teach people? And then I was like, aha, I have a company. And I was like, aha, I'll tell them we're doing corporate retreats. And then I would like force like 60, 70 employees to get in a room, and I would
Going to
just
the
start
hotel.
working on them, you know, like, again, I'm sorry for those of you, those employees that knew me at that time.
That's
I had no idea what I was doing. I just thought I was a hammer and thought like everybody was a nail. So I was just like, like I had no compassion, no delivery. And yeah.
No, it really was not like that. I would have
I
to
know.
say.
Okay.
From the perspective,
I'll
it
probably be
never
hard on
came
myself.
Off, you are. It never came off like that. But it was, again, the intention though came across. Like
Sure.
I have to say, like it made sense why it even was like that back in the day.
Yeah.
Like you wanted to bring people together and get the best out of people.
Sure.
And you still do, right? And I think
Yeah.
you do. At the end of the
Thank
day,
you.
like
Thank you for that.
there's people around you that have been around you for a while for a reason.
And you know, one of the greatest gifts being a leader, a teacher, a catalyst is when you have a student, a mentee that is hungry and they're willing to do the work. And so that is my experience with you. Like anytime we've ever brought something to the company, like we want to start this new 4x4 training, this new 7x7 training. We want to roll out all these new programs for all the staff, for staff development, professional development, personal development. You were always like, hell yeah, let's go. And having you support me, I don't know if you know this or not, but like really encourage me to keep going, because there's a lot of naysayers. There's a lot of people that were resistant to this. And I think that's a lot of what I went through in the earlier years, because like my intention was like, I want to make the company better. I want to be the best in the world. And the only way for us to be the best in the world is like, we have to be the best. We have to show up in healing and compassion and connection and vulnerability and authenticity and like identify our problems, identify our mistakes. And like, there was always this, like this fight of like, oh, that's personal. It's too personal. This is professional. But the truth is how you show up in one area of life, more than likely you're going to show up very similar in another area. And so it really is like a work-life integration.
Yeah.
You know, I don't believe in like work-life balance. Like we've built a culture of like integration.
Right.
You know, because like what I do say, that if you're going to come here to work at this organization, I guarantee you're going to leave a better human being. You're going to leave a better professional.
Right. And I think it like weeds out itself too, right? Like people who, for whatever, another analogy in a way, and again, therapy taught me this, and it's
Sure.
really speaking to what you're saying. If you're on a scale of 1 to 10, right? If you're at a 10 and of healing, right? 0 is like you're not healed at all. 10 is like you're doing the
Sure.
work. If you're at a 9 and somebody's at a 2, there's only so long they're going to stick around. But it's not because you're doing something wrong or not right.
Right.
You're not at the same place,
Sure.
right? And I think that goes with this in terms of who's willing to get that deep and that personal, and where they are in their journey. They just might not be there yet.
Yeah, they
and
might
that
ready.
weeds itself
Yeah.
out. And you get people who are willing and jump in and do the work and kind of move
Sure.
across that scale. And then you have the best of the best because they're doing that.
Sure.
You know, they're getting to the 10 or whatever.
Yeah, and you know, a rising tide raises all ships, and I think we've gotten better at that over the years, like identifying talent and identifying the key people, because we've learned through mistakes. I
Yeah.
mean, there was a time when like if you had a heartbeat, you're like, you're the new director. Like remember that? Like we should just throw people in roles.
You want
like,
to do it? Let's go.
You're in?
Right.
All right, go. I've never
said
done this
yes?
before.
Awesome.
We just want to stick people in roles and positions because I didn't know any better. And now I understand like personality traits. I understand like pattern recognition. I understand all these. Yeah, it's all that stuff's so powerful.
That's funny.
And so what is one of the things that you love the most about your career here at We Level Up?
I think it's what you're saying, like all the growth opportunities, like personally and professionally. I mean, I started as a therapist and now we are not there anymore.
So what is your role now?
The director of quality assurance for our organization across all states, across the country, which is very cool.
And you're now licensed in multiple states?
Yeah, licensed in Florida, Jersey, Washington State, California, Texas, and really all because of We Level Up. Like I would not have done that probably.
A little nudge.
It was just me on my own, so thank you for that.
A little nudge.
But again, it speaks to the growth. Like I say this so wholeheartedly, and people probably think it's BS, but it's the truth. I would never work for another treatment center. Like
Thank you for that.
The industry can be really toxic and really not helpful, and I would just have no desire to like do that anywhere else. But it's because of what you've built, the culture, and the ability to have a voice, you know, like to know you, right? And be able to sit here, like you're the owner of the company and we can sit and have a conversation.
Sure.
That's valuable. You know, that's something that's attractive to want to work here.
And what I will expand on, and thank you for saying it's me. I only exist because of people like you. I only exist because of the people around me. And I get it. Maybe I went first. Maybe I've blazed the trail. But the truth is, like, the core of We Level Up is because of all the people that I have around me. Because knowing that you all have my back inspires me to want to go out there and blaze trails and actually do the stuff that's difficult, do the stuff that most people don't want to do. And I know a lot of business owners, especially in this industry, that don't practice the way we practice. Right. And that was my obsession. Like, how can I be an X factor? Like, what can I bring to the team that is going to differentiate us from everybody else? But again, like, your desire to blaze your own trail within the organization is a big reason why we've had so much success, because I don't know, why don't you explain like your role and like how important it is to the organization?
Well, and it grew so much too. So I remember even bringing the idea when I was having my first child. I'm like, I would love to do something different and bring something that we don't have really. And it kind of was there, but then went away.
So let me just highlight what you're saying. So here we are as an organization, we're operating, and she comes to the table, says, hey guys, I think we really need to evolve this department, because if we want to grow multi-state, hundreds of patients, like, this is a key component that's very necessary. And what was that?
To have a company that listened to that was pretty cool. Right, because at the time it was 2 locations. We had Lake Worth and we had we had one other one.
Yeah, I don't remember.
And now very different, obviously. So the idea was to have a quality assurance department that really oversees what we're doing, right? To know our practices are in line with what they should be, the best practices, the best level of care. Everything is in alignment with what we're offering to patients, what we want to offer to patients. You know, on the business end, a couple of things, and to have somebody really have an eye on that. And then you guys were awesome and we're like, let's go for it. And now it's very helpful because we have across the country, 6 locations now, going on 7. So to really have my department oversee the quality, you know, kind of exactly what we're talking about. Like, do we deliver the best services that we can? Where can we improve them? Where are we falling short? How do we improve? And making sure we're doing what we need to be doing.
It's so important having that open book policy where it's like transparency is key. Like, that was something that I learned from Tony. Thank you, Tony. He would always teach me, Ryan, if everybody doesn't know what's going on, then nobody's going to really know what to do. And you created a path to where we were able to fall in love with the customer, fall in love with the product versus falling in love with the company. Right. And I know that kind of sounds cliche, but the truth is like your obsession was like, how do we make sure that these patients are getting the best care possible? And what's so cool about this, and I'm going to give you a jackpot right now, because of how badass you've been and what you've created with that department, we've negotiated much higher rates from an in-network perspective.
those were fun
Spokane Valley.
conversations, yeah.
Remember our phone calls?
Yeah.
So
yeah.
like we
We would
decided.
celebrate when.
Yeah, it was such a win
Yeah.
because I remember like we're negotiating rates and they got to the final piece and they're like, this is your rate. And we're like, how can we survive? And then we set up our call and we're literally on the phone with the person that's making the decision to give us a rate. And we're like, well, let me just tell you the difference of who we are. Let me show you our hearts. And they're like, holy shit, you guys are right. Here you go.
Right. And kudos to you because wanting to get on the phone, right, and do that.
Yeah, I was like, nah,
Is it
this isn't
game
happening. I'm like, this isn't happening. No way.
We're not saying
I want to talk
take
to
a no
her.
for an answer, but it works, you know. And at
Right.
the end of the day, that's you. Like you
Thank you.
are very transparent, I think, and again, it's attractive to want to do that, emulate that, grow from that, right? So it hits on so many levels. But I agree, that was always teamwork too.
Yeah,
I mean, a
for
bunch
sure.
of us worked together and we got the job done.
Yeah. So thank you for sharing what you love the most. Why don't you talk about what you don't love the most about We Level Up?
This is probably going to sound so cliche, but I don't even know.
Dig deep.
Oh God, what I don't like about We Level Up, that I don't get to come here and see everybody all the time.
More trainings.
Right?
Remember in the
Let's do
beginning, like everybody
more.
hated it. Now we're like, more trainings.
Where'd they go? Let's do more of them. I mean, that's a really tough question because I truly can't even answer that. Like, because to be honest,
But that wasn't always the case.
No, probably. Well, I mean, I left at a period of
Yeah.
time. It's funny because I think that also shows your transformation and who has stuck around and who's weeded themselves out. At the time, I think it's twofold. I was not in a place. So exactly what I said before, like people not being ready and then them weeding out on their own. That was me. Like I was not in a place. I remember I had a phone conversation, I think, with you about going to a personal development like course before, you know, we kind of did it. You did
Sure.
it on your own. And I was like, no, like I don't want that. That's too intense. It's too personal, right? Like I do not want to do it. And I didn't do it. But I also left at that time. And I think there's also a reason why I came back. You know, I took a little bit of time away and did my own stuff, kind of ventured into different aspects, but then I came back and I came back for a reason.
You know, it's so interesting. You're talking about something that's so important. Like most people resist change. Most people resist growth. And I've adopted the saying, like, where you resist persists.
Right.
And so talk about like the resistance to change and then pushing past that resistance, like doing the work and like looking back, like, thank God I did the work.
Yeah. I still to this day hate change. Like
Who does like
it's
it? I mean,
weird. Yeah, like it's very hard.
Sure.
So that was probably a prime example of like I was very resistant. I didn't. It's funny because it's like your employer, right? So I didn't want to like
Let me
disappoint
down.
you, but I also
Leverage.
knew like I couldn't do it at that point in time. Like
Sure.
and even language, right? Like in my head I couldn't. Like not that I wouldn't, I couldn't. I
Sure.
was not able to. And then I'm trying to think of even what like the breaking point for me was. Whatever it was, I remember thinking like, I just can't do this anymore the way I'm going. And especially with a boyfriend at the time, but husband now, like something had to change. I was living in mental hell and torture of like trying to control everything and not wanting change. And like, I have to be on top of everything. And if I'm not, something's going to happen. It was like a PTSD response.
Sure.
And I was like, I can't do this anymore. Like I'm exhausted.
Yeah.
And then going to therapy and doing the work, it was, I think you said it before, like freeing. I was just like, I can breathe.
Yeah.
Like I don't have to live like that. Oh my God, what a concept. I don't have to control everything.
Sure.
Control's an illusion. You can't anyway.
Right.
Like it was just like, I feel like I'm toot my own horn a little bit. I'm like a delight nowadays. Like I was not like this.
Right.
I was miserable.
Right.
And now I'm just like lighter. I like change. And now I'm open to it because once you get a taste of what it could be, right? Like why wouldn't you do more of
Sure.
it? Like recovery.
Sure.
When you get an idea of what that's like, why wouldn't you dive kind of
Sure.
head first into it?
It's so funny because you're talking about another way to say what you just said was, you know, most people are motivated by pain or pleasure. And unfortunately, it takes a ton of pain for
Right.
somebody to hit that threshold where it's like, I want to change. I want to do something different.
Yeah.
The gift of desperation,
Right.
you know, when your back's against the wall, I think that's when we perform the most.
For sure.
That's when we find that leverage to change.
Right.
And we meet a lot of patients and customers that come to us when they're at that breaking point.
Right.
And it's so important because we want to teach our team how to navigate through that difficult
Yeah.
time, that resistant time, where it's like we know on the other side of that bridge
Right.
is everything that I've ever dreamt of, but it's so damn scary. And like encouraging people and walking people across that bridge ultimately gets them to a place of freedom,
Right.
of healing.
It's just funny you use that analogy because my therapist says it all the time. She's like, you'll be on the other side of the bridge, and because part of my stuff too is like family stuff, right? It's always family on some level.
Sure, sure.
And I want to get a certain member of my family over to my side of the bridge. And I remember her telling me that, like, it's their journey, right? But you get over the bridge, you can wave from across the bridge, and the best you could do is model, right?
Yeah.
Like how to get to this side of the bridge.
It's so true.
But yeah, pain or pleasure for sure. And that pleasure is so much more motivating than the pain. So once you get the taste of it,
Sure.
it hopefully brings you to that other side of the bridge.
I think both happen at each level. So I feel like there's
Right.
levels to life, and they say new levels, new devils, which is true to a certain extent. So I feel like there's a breaking point. You have this pain. You're like, I'm done. I want to change. I want a different life. I want a better life. I want to be a different person. Great. Then all of a sudden you experience pleasure. And you're like, oh my God, this is amazing. I feel great. And then all of a sudden disruption follows intention.
For sure.
And then you're like, wait, oh shit, it's not what I thought it was. Oh my God, it's not all what it's cracked up
Fear.
to be. Oh my God, I got to do a lot of work. Oh shit, I don't feel like practicing. And then you feel the pain again.
For sure.
And then you're like, and then you have a breaking point. And then you're like, oh, this is exciting. This feels good. And there's like, it just constantly is like
Levels.
this on rotation of like pain and pleasure, pain and pleasure,
Right.
pain and pleasure.
Right.
So I don't ever know if that ever goes away. And I don't know what comes first, the chicken or the egg, but
Right.
I feel like it's a part of the journey. And this is where, repetition is the mother of skill. Like you have to adopt a practice every single day of your life that is driving you towards
Right.
your future self. And if you don't know where you're at, like if you don't know what the core issue is, the cause of it, how do you know where you're going?
Exactly.
You got to have a starting point.
Right. And I think I agree with you 100%. And like, I'm a big believer of like, God is going to keep giving you the situation until you learn your lesson.
That's so true.
So like, speaking of different levels, there's always going to be the disruption and then the calm and then the disruption and the calm. But I would think that the goal and the reality is you deal differently, right? Like
Sure.
you cope differently. Maybe it's not as hard the next level and then the
Yeah.
next level. It gets easier. You're still going to experience it because that's life, right? And how
Yeah.
are you going to learn
So true.
if you're not going to experience any type of disruption?
So true.
But the way you deal with it's different.
So true. The number one problem everybody has in life is that they think there shouldn't be problems.
Yeah.
And once you understand that life is all about solving problems and seeing new problems because you have a different level of consciousness, you have a different level of awareness. So the problem that you think is in front of you now changes once you solve that problem. And then there's like, oh, there's another problem. And there's another problem. There's another problem.
It's, again, funny you bring this up. The one thing I learned too that was really helpful, like what if, so speak, there's always problems, right? There's always something.
Sure.
What if you looked at everything though as a neutral experience? Because I remember something that was hard for me was like, I don't know the right choice to make. So not only do I not want to ask for help, but I don't want to make the wrong decision. If I do, it's like imposter syndrome, right? And all these things go through your head. But what if door A and door B are both neutral and they're just an experience?
That's
and
good.
you walk through A, okay, great. A is going to bring you to the next set of doors. And then it's still a neutral experience. If you took the good, the bad, the sad, the out of all of it, and it's just an experience, the way the pain and the disruption shifts, right? It's all a matter of perspective and language and what we put meaning to. It can significantly change how you go through life.
It's so interesting. And I love what you're saying because I think like the idea of like door A, door B, you go through, you have the experience, whatever is going to be is going to be. But I think what's really cool that I'm really like diving into now is like who are you? Who's the person walking through that door? And I think that's what matters the most. And that's why I think people fall short. Like the character, like who are you being in this moment before you walk that door? And I believe depending on who you're being, depending on the character that's walking through that door, the opponent that you're going to be facing is going to be much bigger, much greater, much more impactful. The experience is going to be significantly greater because I believe the universe gives you what your nervous system is capable of receiving.
Right.
Or you can say God is going to give
As much as you can handle.
as much as you can handle,
Right.
or
Right.
yeah. So I think it's so powerful. I think that's where people fall short and they have the misconception. Like who are you being in this moment? Like who are you being solving that problem? Yeah, the problem sucks, but if you're being a grateful, loving, compassionate, excited person, then your experience is going to be significantly different.
Sure. Yeah, like you manifest your experiences too, right? Like you manifest what it is, right? The context, the the experience of it. You know, what your energy, right? We talk about energy all the time. Like your energy, how it is going to dictate that experience. And
So true.
I think a lot of people honestly just not don't have, but don't pay attention to like just their own awareness, right? Like how they're being in the moment, being in the present moment, being intentional with every step you take. It doesn't have to be right or wrong, but just being present and aware,
Sure.
you know, of kind of who you are, what you are, what's going on.
Sure. If somebody is struggling with alcoholism, mental health illnesses, depression, anxiety, what's your message to them? What's your message of hope if a listener hears that that's struggling right now?
That there is hope, and that what kind of what we touched on before, like talking about it is so freeing. And it does not even have a purpose of the talk.
What if they don't know where to go?
Talk. So there's plenty of ways to find help. It sounds so cliche in a way, but like Psychology Today is like an excellent tool.
Give it a shout out for Psychology Today.
I love Psychology Today. We level up. I mean, if you're looking for somebody, we know a bunch of resources, or us personally, that we can help. Obviously, we got a ton of different people that do a ton of different things. Help you with us or a different direction, whatever it may be. And I would say just start, right? Just pick up the phone, call whoever you need to
So
call.
you're saying the first step is the most difficult?
Oh, for sure. I think kind of going along with the program in a way, like admitting you have a problem is the first step,
Yeah.
right? Being able to acknowledge you want something to change, right? You don't have to know what it is. You don't have to know what you're struggling with necessarily, but just that you want something to change, right? The desire to stop in the first place, I think, is the first step. And realizing there's nothing wrong with you for dealing with that or struggling with that. It's not you, it's what you're dealing with.
Sure.
And that awareness, that understanding, I think can take some of the stigma away of like, okay, I'm not messed up. It's just what happened to me or what I'm dealing with. That's the
So true.
problem. And that's what I'm going to go get help for.
Sure.
You know, it's not you as a human being.
I love that. And so in closing, what do you think is important for listeners to hear from your experience in life? Or what do you think being a mother now, having a family, being a wife, like what do you think is like one of the most important pieces of information that you can share?
That people are in your corner and the universe does for you rather than against you.
Wow.
But it's how you look at it.
Wow.
You know,
So perspective.
You
Wow.
can have the perspective that it's fighting against you or fighting for you, and no matter that situation isn't going to change. It's how you look
Sure.
at it.
And so it's so true because I now know today, like I am 100% responsible for my perception of that
Right.
situation or
Right.
that moment. It's crazy because you have 10 people looking at this flower, and every single person is going to say something
Exactly.
different. And
Exactly.
every single person may be telling the truth.
Right.
And it's
Their
like
truth.
once you understand that that's the human condition, then you have a little bit more grace and less judgment
Exactly.
around like their opinion or their views. So I
Exactly.
think that's amazing. Lauren, you've been a blessing. I'm so honored to be with you on your team. You've been such a support. You've built such an incredible department. You've helped so many lives, and I'm just so grateful for you. And so thank you so much for sharing your time, and I can't wait to see where we continue to go.
Well, thank you for having me as part of your journey. It's been an honor.
Thank you.
Thank
God
you so
bless.
much.
Awesome.
Cool.
Wow, you're the best.
You're the best. Thank you for having me.
Can I be honest? Yeah. That was my favorite podcast.
That was amazing. I'm sending this one to Mama.
That was
I'm sending this one to Mama.
that was my favorite podcast. Two things.